stem cells for other conditions. You said that 30 years there is evidence for orthopedic. Even talking about autism,
Yeah.
and then it's a very debatable topic.
Yes.
Whenever I talk about this, I get a lot of heat.
Yeah.
In terms of like, why are you promoting this is pseudoscience, all
Yeah.
those things. What is your take on those kind of treatment
Yeah.
options compared to this?
So basically, we're presenting the science and evidence. It's not like a promotion of unclaimed things. We have to tell what's advancing, what's been proven, and the patients will be educated. The question is about autism. So it's more a systemic issue. Those are more neurological based. As I mentioned, the evidence on non-orthopedic is building up right now. So it is still early, although that becomes a realm not in my field because I'm a specialist in sports and orthopedics, but I know the stem cell field. So there's a lot of research happening, treatments happening. Mostly in US, they're university basis. So you take the patients and you treat those things. Outside the country, it's happening. But the question is, the credibility, long-term studies, and the results, publications, we're still lacking on those
and
things.
Not regulated.
Outside the country. Yeah. So one thing that's regulated is autologous, what we are talking. Our own, there is no problem in there. And there is enough evidence on this. When you're using treatments that are more systemic in nature, like, neurodegenerative conditions, cardiac, there is not enough evidence. So promoting that with some kind of surety is not warranted, but there are patients that are desperate to get some treatment. And if the patients are trying to take the risk, I have 0 treatments out there, I don't mind taking risks, they usually go to South America or Europe and get those treatments done as well. We have seen those things, but we cannot really talk or validate that without enough evidence. Like, for example, orthopedic, you can ask me, do you have evidence of a disc procedure, stem cells, or do you have evidence of, we can give you 30 studies or 40 studies, including internal studies, worldwide studies, patient stories, because we have body of work, right? It just didn't happen today. It's been going on for 20 years. Yeah, in India, it's a little new, as I said, because in India, it's all heavily surgery focused. Orthopedic is surgery focused heavily. Naturally, you'll see less and less of non-surgical methods, but the evidence is there worldwide. So that's the difference between these two.